All right, I think we are live. All right, so hi, good evening, everyone.
Good evening, sir.
So, to all the viewers, today is the day, the grand finale of the step one for DBMCI FMG. And from the previous rounds, we have got some toppers, and these five are the ones who will be fighting for the rank one today, the spot one today, and going to get the grand prize. I hope all the viewers are also ready, right? So I have with me today Dr. Sakshi, Dr. Lalita, Dr. Saurav, Dr. Kriti, and Dr. Vinash. So all five of them are going to have a tussle today to just be on the rank one and get that grand prize, right? So wonderful achievement already done by all these students. They have been through all the previous rounds, all the previous episodes of the step one, and today is the finale. So I'll just start the quiz in a while, and we are going alphabetically. We are starting with Dr. Vinash. So this grand one, this grand finale for the step one, is going to have multiple rounds, and it is all the academics, right? All the academics, which is one liner, which is clinically oriented, which is image based. So everything has been put here, and let's see who just cracks this. Who is going to have that? Dr. Vibhuti, can you please अपने माइक प्लीज आप लोग म्यूट करो. All right, thank you so much. So let's see who is going to be the top ranker today, who is going to get the grand prize today. So all the best to all of you from my side, and viewers, you too stay connected, and let's see how these questions are and how our toppers are going to answer this. So we start from Dr. Avinash. Arvind, we are ready to start, right? So Arvind, we are starting with the round one with Dr. Avinash, and we are going to have, yeah, so we are going to have a timer, and in that time period only you have to answer the question. Okay, so you are going to have the question number one in front of you. Arvind, if I can have some message. Yeah, great, thank you. So all right. Uh-oh. All right, so I'm starting with the question number one, the very first one. Let me start with that. All right. Okay, so Avinash, for you, the participant one, here comes the first question. Arvind, you are ready with the timer part? Yeah. Yes. Great. So this is Avinash for you. This is for you. Your question number one: molecular defect causing liver disease in Dubin-Johnson syndrome. Avinash, you would like to answer any one of the four?
Yes, sir.
Take your time. Take your time. You have. Arvind can't see the timer. Avinash, you want me to go to the second question?
No, sir. Uh, Option D.
Option D. All right. So correct answer is option D. Wonderful. Very good. Second question: 26-year-old primary gravida delivers a 1.5 kg baby girl at 27 weeks of gestation. When is an ophthalmological examination recommended for initial screening of retinopathy of prematurity in this baby?
At the time of birth.
At the time of birth, option D. So correct answer is option B, 2 weeks postnatal. All right. So we move on to the question number three. Ring sequestrum, where do you see that? Sequestrum, you all know. It's a
Yes.
dead bone, right? Seen in chronic osteomyelitis, chronic infection of the bones. So, in which kind of infection, where do you see this ring kind of sequestrum? Little tricky, little tough, but a clue is there in the name itself, if you can find it out.
Um, Pin tract infection, sir.
Wonderful. Pin tract infection. Ring is round, pin is round, so round वही मिलेगा ना? Round round. Very good. Question number 4. 53-year-old woman is found to have raised serum alkaline phosphatase. Urinary examination reveals increased excretion of hydroxyproline in urine. X-ray skull of the patient shows cotton wool appearance. Which of the following statement is false regarding the treatment of this condition?
Wrong option is option C, sir.
Option C is wrong. What is the diagnosis? Viewers, what is the diagnosis? What do you say? B, D, Akash. Diagnosis batao jaldi jaldi. What is the diagnosis? Correct answer is option D. The diagnosis is Paget's disease. Most commonly used bisphosphonate is alendronate. All right. Which of the following feature is not expected to be seen in a patient with right middle cerebral artery infarct?
Option A.
ऑप्शन ए डिसार्थ्रिया. लॉक करें, आगे चलें. So option A nahi hai sahi. It is option D. It is aphasia, right? Middle cerebral artery infarct will have aphasia. Will not expected to be seen. So it is option D, aphasia. What is the most commonest type of hereditary neuropathy? Most commonest type of hereditary neuropathy. देखो बहुत सारे आंसर्स अलग अलग जगह से अलग अलग आ रहे हैं.
Familial and amyloid polyneuropathy.
Familial amyloid polyneuropathy. Correct answer is Charcot Marie Tooth disease. चलो, which of the following statement is correct regarding with the rule astigmatism? Correct statement you have to find out. And it is in relation to with the rule astigmatism.
Uh, Vertical meridian is more myopic.
Vertical meridian is more wide. Option B, you are saying? Okay,
Yes,
so
sir.
option B is correct. Wonderful. Option B is absolutely right. Where is snowflake cataract seen?
Snowflake. Wilson disease.
Wilson disease. It is in diabetes
Sorry, sir.
mellitus.
It was Catherine's. Yes.
गड़बड़ हो गया, कोई बात नहीं. Primary gravida is in labor. Her per vaginal examination reveals a posterior cervix with 5 centimeter cervical length, 1 centimeter dilatation, soft consistency, and head is at -1 station. What is a modified Bishop score? इस बार तो FMG में भी आया था ये. So three things are there: posterior cervix with a 5 centimeter cervical length, 1 centimeter dilatation, head at -1 station.
Option B.
Option B, score is 5. Okay, wonderful. That is score is 5. Very good. Last question you have. According to the WHO labor care guidelines, documentation of labor progress begins at cervical dilatation of
4 centimeter.
4 centimeter. All right. It is 5 centimeter. So, all right. So, Arvind, what is the final score out of 10 questions? So, the final score, okay, time has been up. 7 questions attempted, 3 correct. Oh, is it? 3 for Avinash. Late answer before time's up. Okay, 1 minute left. Okay. So, before Avinash, your time was up. 7 questions were attempted and 3 were correct. Right. So, please take care of time also, everyone. Uh-oh. Please take care of time also. Right. So, Arvind is marking the scores. So, for Avinash, the score has been, yeah, out of 7, 3 have been marked correctly. So from by question number 7, your time was up. So time, please do take care of time as well. So who is second now? Second will be Kriti. You will be second. Kriti, you are there with us.
Yes, sir.
Yeah. All right. So ready for your questions? Can I start?
Yes, sir.
All right. So here comes your question number 1. Arvind, we are starting. Please set the timer up. 9-month-old boy presents with progressive pallor and abdominal distension. The Menzel's index was found to be less than 13. What are the investigations to be done in this patient? High performance liquid chromatography, the HPLC, PTA, PTT, bone marrow, or the peripheral blood smear? What do you say? All the four, 1 and 2, 1, 3, 4, or 1 and 4?
C.
See, 1 and 4 you are saying? 1 and
Or
4,
it
Kriti?
can be D also.
Choose one. Only one has to be
D,
taken.
D, D,
D, 1, 3, and
D.
4. Correct answer was earlier 1. C was correct one. Okay. So let's move on to number 2. A 3-year-old baby was brought by his parents to the emergency room. Parents complained that the child has been lethargic for a few hours and unresponsive for the past 30 minutes. They gave a history of 4 to 5 episodes of vomiting in the past one day. On examination, the baby had tachycardia, tachypnea, and very slow capillary refill time. Pediatrician asked you to initiate IV fluid therapy with a 24 gauge IV cannula. Which color IV cannula would you use? So, 24 gauge IV cannula is of which color?
It's a pink D.
It's pink, D or yellow. बच्चा है छोटू. No, छोटा baby is yellow color. Okay, pink वाला तो और ऊपर जाता जाएगा. चलो, coming on to next one. Which of the following statement is false about metal on metal implant? मेटल थोड़ा ट्रिकी है, थोड़ा टफ है. मेटल और मेटल के लिए कौन सा गलत है? पेशेंट विद दीज इम्प्लांट विल हैव नॉर्मल लेवल्स ऑफ कोबाल्ट एंड क्रोमियम. It cannot be used in patient with renal failure. High carbon cobalt chromium alloy has been shown to have lower wear rates, and these implants are avoided in young female.
So C.
C. High carbon. The false statement you are supposed to choose. Patient with these implants have normal levels of cobalt and chromium. See, all the other options are telling you कि ये सारे मेटल जब बॉडी में जाएंगे तो टॉक्सिसिटी कर सकते हैं. No, so they are asking you the false. All right. Rupture of which tendon is most likely to occur in the patient with Colles? A very, very conceptual kind of question.
Common question.
Colles में which tendon would be easily breaking out? Arvind, can you tell me how much time is left? Question number 4 we have reached. Rupture of which tendon is most likely to occur in Colles? Let me help you out. Colles का
Uh,
डायरेक्शन ऑफ डिस्प्लेसमेंट क्या होता है? जहां डिस्प्लेसमेंट होता है उधर का टेंडन टूट जाएगा.
so B.
B. Abductor pollicis longus. It is extensor pollicis brevis or extensor pollicis longus. Extensor tendon, because the fragment goes back and fragment goes laterally. Chalo, next one. All of the following are true. 3 minutes left, Kriti. All of the following are true about the risk factor of NSAIDs associated peptic ulcer disease, except all are true. Which one is a false statement? H. pylori infection increase the risk. Even low dose of NSAID can cause ulcers. Smoking increase the risk, and concomitant use of glucocorticoid decrease the risk.
Sir, C.
See, smoking increase the risk. It is glucocorticoid decrease the risk. How can steroid decrease the risk? Steroid can never decrease the risk. Chalo, jaldi, quick. Which of the following is not a non-structural protein 5A inhibitor used in the treatment of patient with hepatitis C infection?
C.
C. It is A. Sofosbuvir. Okay. How many weeks following cataract surgery are spectacles prescribed? The nowadays the concepts are gradually changing, but this is the question for your exam as well. Arvind, time how much? Kriti, 1 minute left. 3 more questions to go.
Sir, B.
B. It is C. 6 weeks. 39-year-old contact lens user with a corneal ulcer showing no improvement to tobramycin drop was referred to a tertiary care center. Corneal biopsy revealed double-walled cyst within the stroma. Which of the following is the treatment of choice? Double-walled cyst is the clue.
Sir, C.
C. It is wonderful. It is right. When does the ovary contain the maximum number of oogonia? Quick. And one more is there, or else the time will be up. Time's up. Time's up. This is the last question to be
A.
considered. Time is up. So it is C again. It is 5th month. Okay. So anyhow, try kar lo ye question. Your time is up. You are performing capillary blood glucose charting for newborns in the postnatal ward. Below what level is considered hypoglycemia? Everyone in the audience, if you can answer that. A. Everyone is saying less than 40. Okay. So it is less than 45. All right. It is less than 45. Chalo. Wonderful, Kriti. You attempted well. Chalo, who is next? तब कौन आ रहे हैं? Next will be Lalita, right? Lalita, you will be next.
Yes, sir.
Ready? Shall we start? Participant number 3. All right. Here comes your question number 1. Take care of the time as well, right? So your question number 1. A mother reports to you that her baby is irritable and cries all the time. She has also noticed that her infant sweats excessively while feeding. Which of the following finding noted during the examination would you not include under NADA's major criteria? You would not
C, sir.
B or C? What did you say?
C. C for cat.
C. Grade 2. Okay, option B is right. Wide and variable is true. Doesn't matter. 9 more to go. 11-year-old girl was brought by her parent with complaint of weight loss, increased appetite, decline in the scholastic performances. Following investigation or diagnosis of Graves' disease is made. Which of the following is a drug of choice for initial therapy? Graves' disease, 11-year-old girl. Which one?
B, sir. B.
B. Mobile
B for
thyroid
boy.
It is methimazole, right? It is methimazole for this question. Chalo, what is jumper's knee? What is jumper's knee? What is jumper's knee?
A, sir.
Patellar tendinitis. Very good. At the tendo-ossei junction of patella. Okay, fine. Chalo, correct answer here is A. Which of the following is the first ossification center to appear around the elbow? The first. Which of the following is the first? There is a mnemonic also for this. There's a
D.
mnemonic
Is
also
it,
for this. Sorry?
is it D?
D. Oligranone. अरे गड़बड़ हो गया. CRITOE. Crito. CRITOE. Capital M is the first one. 23-year-old patient present with rapidly progressive symmetric ascending paralysis since last 2 days. Nerve conduction studies are consistent with demyelination. He is found to have elevated protein level in his CSF. Which of the following autonomic nerve disturbance is likely to be seen? 23. Rapidly progressing symmetrical ascending paralysis. Acute onset, 2 days. Right? Nerve conduction tells you demyelination. Which one? A?
A.
A. All right. It is C. Postural hypotension, number 1. The is likely to be seen. Okay. Raised intracranial tension is not associated with which of the following manifestation? Raised intracranial tension is not associated with which of the following manifestation? Come on, come on, come on. Arvind,
Sir,
time.
A.
Yeah. A. Paraparesis. Very good. It is correct answer. Which of the following technique is a gold standard for assessing corneal thickness? Corneal thickness. How will you check for corneal thickness? Come on, come on.
Is it C?
2 minutes left. C. C you are saying?
C, sir.
B. Ultrasound, right? Ultrasound pachymetry.
C, sir. C.
C. Corneal topography. Correct answer is ultrasound pachymetry. Chalo. Patient with sarcoidosis shows copies nodules on ophthalmologic examination. Where are these seen? Patient with sarcoidosis shows copies nodules on ophthalmologic examination. Where are these seen?
A, sir. A.
Conjunctiva, it is
Conjunctiva.
iris. It is iris. Nodules, copies nodules on iris. Question number 9. In patient with vulval cancer, what is the least commonest route through which the malignancy spreads? Least commonest they are asking you. Least commonest route through which the malignancy spreads. One more to go. B. Direct you are saying?
Lymphatic, sir.
Lymphatic, D lymphatic. Okay, it is vascular. All right, last one. 30-year-old woman is found to have a lesion in the cervix which is 7 mm wide and has a depth of 4 mm. She has one child and wishes to preserve fertility. What is the most appropriate management? 30-year lesion on cervix, 7 mm wide, depth of 4 mm. She has one child and wanted to preserve the fertility. What is the most appropriate management? Cryoablation, you're saying? Yes. पढ़ो तो दोबारा question. It is radical trachelectomy with pelvic lymphadenectomy. All right. So 10 done. Arvind, what is the final score for Lalita? So 2 out of 10. थोड़ा गड़बड़ हो गया, which is absolutely all right. Chalo, let's move on to the next one. Who is participant number 4? Sakshi, you are there.
Yes.
Participant number 4. You ready?
Yes.
Shall we start?
Okay. Yes.
All right. So here comes your first question. Chalo. Arvind, ready? Yeah. So very first question. What is the secondary attack rate of chickenpox? A factual question. Secondary attack rate of chickenpox.
I think C.
C. It is 85%. It is D. A baby assessed 5 minutes after birth is found to be cyanosed with irregular gasping respiration, heart rate 60 beats per minute, and show minimal response to stimulation with some flexion of extremities. What is the Apgar score? Cyanosed, irregular gasping respiration, heart rate 60, minimal response to stimulation with some flexion of extremities. What is the Apgar score?
D.
Which one? Sorry.
D.
B. You are saying 3.
D for dog. D.
D. You are saying 2, right? Score of 2.
Yes.
Yes. Okay. It is score of 4.
Okay.
All right. What is the most common site of osteochondritis dissecans of the knee? What is the most commonest site of osteochondritis dissecans of the knee? Very, very logical question. Not a factual, very, very conceptual question. So now let me help you out. This is the site from where the mechanical axis passes. This is the most pressured point in the knee area. How the weight is going down. Let me see viewers में से कौन सही बताता है इसका आंसर.
C.
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 Lateral part of medial tibal condyle? No. It is option D. Lateral part of medial femoral condyle. Right. Patient with a spinal injury presents with a decreased sensation over the radial aspect of forearm, thumb, and index finger. There is weakness of wrist extension on examination. Which nerve root has been damaged here? Which is the most involved root here? Decreased sensation on the radial aspect of forearm, thumb, index, and weakness of wrist extension on examination. Which nerve root has been damaged here? Which nerve is
A.
this?
A.
A. C5. It is C6. Most importantly, wrist extension. Weakness of wrist extension. Which of the following drug has disease modifying action in Parkinson? Disease modifying action in Parkinson. Arvind, time please.
C.
C. Salicyline. Okay, that is correct answer. Very good. Wonderful. Which among the following is the most common indication for liver transplantation in children? Which among the following is the most common indication of liver transplantation in children? 2 minutes left, beta. Sakshi, 2 minutes left.
Uh, D.
D, you are saying? Delhi?
D. Yes, biliary atresia.
Biliary atresia. Yes, that is a correct answer. Very good. Very less time left. A patient present with unilateral ptosis with hypotrophy in the same eye. He was given an IV injection, following which the symptom go away. Which of the following is the most likely diagnosis?
D.
D. Third nerve. It is myasthenia gravis. Okay. Knudsen two-hit hypothesis describe the occurrence of which of the following? Knudson's two-hit hypothesis is related to which one? Optic nerve glioma, retinoblastoma, meningioma, glaucoma. Which one?
Retinoblastoma. D.
All right, very good. It is correct. The ultrasound of a young woman with infertility suggestive of a uterine anomaly. Which of the following is used to confirm the diagnosis? Young women, infertility, uterine anomaly. How to confirm? 1 minute left.
C.
Young women, infertility. It is
C.
C. Very good. It is correct answer. And last one, primary gravida. Come to the labor room at 40 weeks plus 5 days gestation for induction of labor. On per vaginal examination, the cervix is 1 centimeter dilated and is 30% effaced. Vertex is at -1 station and the cervix is soft and posterior. What is the Bishop score for this lady?
C.
C. It is 5. Wrong answer. All right. So all 10 done. Wonderful. Arvind, what is the final score? So 4 correct. Sakshi, you have got 4 correct. Chalo. Very good. You attempted so well. Right. So who is the last one? Saurav. Saurav, ready?
Yes, sir.
Can I start? All right.
Yes,
Arvind,
sir.
ready?
Start.
I'm showing the first question. Arvind, get ready with the timer, please. All right. So first one. Peripheral smear of a newborn baby girl sent on day 2 of life shows mild hemolysis. What is the most common cause of this finding in a newborn baby? Newborn baby, 2 days, second day of life. What is the most commonest cause for mild hemolysis? बेटा बाकी लोग प्लीज म्यूट कर लो अपना माइक.
Sir, option A, RH incompatibility.
It is ABO incompatibility. Parents of 9-month-old infant with a history of preterm labor and prolonged NICU stay are concerned that child is lagging behind in his milestone. You would suspect a developmental delay in this child if the development quotient is how much low?
Uh, Around 70%.
Okay, it is 70%. Very good. In which of the following patient would you suspect child abuse?
Sure.
बड़ा लॉजिकल है, आंसर भी बहुत
Sir,
लॉजिकल है.
9-month-old with spiral fracture of right
Of the
femur.
right. Oh, very good. Wonderful. Spiral fracture. So you know the reason why the spiral fracture, the same reason for humerus. X-ray of a patient with femoral neck fracture showed that all three sets of trabeculae were out of alignment with the femoral head, partially displaced. Which garden stage of fracture is this?
Three sets of Sir, three.
थोड़ा
Sir,
ट्रिकी है. ठीक से पढ़ो,
stage
आंसर है
3.
इसमें. Stage.
3.
Very good. It is stage 3. All are out of alignment. Which of the following feature is not useful to distinguish between microscopic polyangiitis and granulomatosis with polyangiitis? Microscopic and granulomatosis.
Uh, Sir, I think B, necrotizing vasculitis.
Very good. Wonderful. Patient presents with quadriplegia and difficulty in breathing. This presentation can be seen in spinal cord lesion at what level? Quadriplegia and difficulty in breathing.
Quadriplegia. What level? I think, sir, between C1 to C4.
Very good. Wonderful. What is the most common cause of proptosis in middle-aged individual?
Proptosis on middle-aged individuals.
Middle-aged proptosis.
I think thyroid, sir. Thyroid is the common
Very good.
for
Thyroid
proptosis.
commonest. A person is diagnosed to have diabetes on his 45th birthday. When will you recommend a dilated fundus examination for him?
Dilated 45. 54. Sir, I think maybe in decrease in vision, because in that case,
Immediate वाला गड़बड़ हो गया. C. Option C is right. Option D is wrong. Quick. An increase in which of the following is a spasmodic pain during dysmenorrhea attributed to? An increase in which of the following is the spasmodic pain during dysmenorrhea attributed to? किसकी वजह से pain है? One more question to go.
yes, sir.
Quick.
I think PGF2 alpha. That's correct.
PGF2 alpha.
F2
Very good. Which of the following is the second most commonest pathological cause of anemia in pregnancy?
So second,
Second most commonest pathological cause of anemia in pregnancy.
yes, sir. I think maybe anemia associated with chronic disease. Megalo will be first.
Very good. Wonderful. So all 10 done. What is the score, Arvind? What is the final score we have? Very good. 8 correct. Wonderful, Saurabh.
Thank you,
So
sir.
all have played very, very well. All have played very well. So this completes round 1. And let me tell you the score of each one of you. So Saurabh is 8 by 10. Then, okay. Sakshi was 4 by 10. Before that, Lalita, it was 2 by 10. Before that, it was Kriti, it was 1. And Avinash का score नहीं लिखा इसमें अरविंद. Please share it again. Please share with me score of Avinash also. Avinash 3. Okay, Avinash 3, Kriti 1, Lalita 2, Sakshi 4, Saurav 8. So well played all of you. Wonderful. The round 1 is done. Okay, so Saurav is leading right now. Sakshi is second, Lalita is third, Avinash is third, Lalita fourth, and Kriti fifth. अभी एक round और है, right? And if you can just make it up, इस round में score भी ज़्यादा है. Clinical scenarios हैं, and I'm sure each one of you is very much ready, right? So gear up. अभी तो one liners थे, अभी तो सिर्फ क्विक करना था, फटाफट करना था, स्पॉटर्स की टाइप में आ गए क्वेश्चन. अब क्लिनिकल्स की बारी है. नाउ बी द फिजिशियन, रीड द क्वेश्चंस केयरफुली, बी क्विक with your coordinations between the mind and the eyes. Let's see who is answering maximum correct. Arvind, are we ready for the second round? The clinical case scenarios. Are we ready? All right. So in the clinical case scenarios, just give me one moment. In the clinical case scenarios, yeah, it is a mystery box. So you have got 3 minutes, right? You have got 3 minutes, okay, per contestant. One clinical case with 3 clues, but I will give you only 2 clues. Right, so in 2 clues you have to find the answer. ओके, सबके लिए क्वेश्चन है एक एक, और एवरी क्वेश्चन इज गोइंग टू हैव 5 पॉइंट्स. सो अभी भी सबके पास चांस है पिछले वाले से आगे जाने का. ओके, सो लेट्स स्टार्ट. शेल वी? अविनाश, रेडी? द फर्स्ट क्वेश्चन फॉर यू.
Yes, sir.
Avinash, ready? Right? Should I show
Yes,
the
sir. Ready.
first question? Ready. Chalo.
Yes.
Case 1, ophthalmology. 65-year-old male presents to the ophthalmo OPD with sudden painless loss of vision in his right eye that started a few hours ago. He described it as a black curtain falling over his vision. He has a history of hypertension and smoking. On examination, there is relative efferent pupillary defect in the right eye, and fundus examination reveals a pale retina with cherry red spots at the macula. What is the most likely diagnosis? If you can tell the diagnosis, wonderful, or I can give you hints.
It's
Let me help you out.
detachment, sir. Retinal detachment.
Retinal detachment. Okay. So sudden vascular cause rather than classic findings. So it is central retinal artery occlusion. It is central retinal artery occlusion. Clue to le lete, hint to le lete. I told you I can give you hint. So CRAO is the right answer for this one. RAPD suggests optic nerve or the retinal ganglion cell involvement, very characteristic of the CRAO. Right? ठीक है. So answer is CRAO actually. चलो second one. Okay. चलो second one. Shall we go? Second one. Kirti, ready?
Yes, sir.
All right. So case 2 is coming from pediatrics. Just give me one moment, please. Just give me one moment. This has logged out. Just give me one moment. Yeah. Okay, so now I'll show you the second question. Arvind, I'm going to Kirti, right? The first question is done. I'm going to Kirti now. Yeah. So Kirti, this is the question for you from pediatrics. A 4-year-old boy is brought to the clinic with fever, cough, and difficulty breathing for last 2 days. On examination, he is febrile. Respiratory rate is 48. Nasal flaring is present, and auscultation reveals crepitations in the right lower lung field. His weight and height are within normal range. Oxygen saturation is 93% on room air. What is the most likely diagnosis? A 4-year-old boy, young boy, fever, cough, difficulty in breathing for 2 days. Crepitations are there. Respiratory rate is 48. He is febrile, laser flaring, right lower lung field involved. Weight and height are okay. Oxygen saturation is 93% on room air. What can be the most likely? You want hints?
Yes, sir.
Child is tachypneic. Respiratory rate is more than 40 for age with respiratory distress sign. Nasal flaring they have given. Fever is given. Think about some lower respiratory tract infection. You want another hint?
Uh, yes, sir.
Crepitations
Pneumonia.
तो बता ही दिया इन्होंने आंसर में. So most likely organism is Streptococcus pneumonia, right? The age is above 2 years and bacterial pneumonia is more common in this group, right? So pneumonia is the answer, which is right, which is absolutely right. ठीक है. Next one. Next किसके लिए हम आ रहे हैं? Next is Lalita, right? Lalita, ready for the question?
Yes.
All right. So it is community acquired pneumonia, likely bacterial one. Orthopedics. Oh, let's see if we can crack it. 7-year-old boy is brought to the emergency department after falling on his outstretched hand while playing. He complains of pain and swelling and deformity around his left elbow. On examination, there is tenderness over the distal humerus, swelling, and the child refuses to move the elbow. The 3-point relationship is maintained. X-ray shows the proximal and distal part of bones are displaced with a visible fracture. What is the most likely complication to watch for in this condition? What do you say? You have 3 minutes. Take your time and answer it very appropriately. 7-year-old boy, history of fall, outstretched hand, pain swelling at elbow, tenderness over distal humerus, No movement at all. 3
Supracondylar
questions.
fracture, sir. So it should be complication is
What is the most likely complication to be watched for in this condition? You want a clue?
yes, sir.
Malnutrition. किसी ने लिखा malnutrition, गड़बड़ मत करो. Most common fracture is supracondylar.
Supracondylar, yes, sir. Malunion, so
दोबारा पढ़ो क्वेश्चन. What is the most likely complication to watch for in this condition?
can I get the second hint, sir?
Sorry.
Can I get the second hint?
Second hint में ना आंसर लिख दिया इन लोगों ने. चलो, take the second hint. The fracture is close to the vital structure, especially the brachial artery and median nerve. कोलीज फ्रैक्चर. ये देखो कहाँ जा रही है हमारी ऑडियंस. रेडियल नर्व, कोलीज फ्रैक्चर, माल न्यूट्रिशन. बाप रे. अरे फ्रैक्चर तो बता दिया. फ्रैक्चर तो बता दिया बेटा. What is the most commonest complication? 1 minute left. What is the most important complication that you will look for? फ्रैक्चर होते ही माल यूनियन.
No.
सोच सोच सोच, जल्दी जल्दी सोच. 5 नंबर का सवाल है.
It's the damage to the AIN, so
AIN तो नर्व हो गई. किसी ने लिखा
Yes,
DVT, माल न्यूट्रिशन. लॉन्ग टाइम न्यूज. वेरी गुड. AVN. वेरी गुड. ऐसे ऐसे आंसर. टाइम अप हो रहा है. जल्दी बोलो, जल्दी बोलो. टाइम अप हो रहा है. 1 मिनट लेफ्ट. सोचो सुप्राकॉन्डाइलर में व्हाई वी आर वरीड. क्यों परेशान होते हैं हम सुप्राकॉन्डाइलर्स में? डिनर फॉग डिफॉर्मिटी. वेरी गुड. सबको जो है ना यहाँ देख क्वेश्चन पढ़ दोबारा से जल्दी. Less than 1 minute left. Be quick. What is the most likely complication to be watched for in this condition? What is that worrying thing which happens with supracondylar which you have to see in every patient? What is the most likely complication to watch
compartment
for?
syndrome.
Very good. Finally पहुंच गए compartment syndrome पे. Very good. चलो finally in the last 30 seconds you answered it right. Very good. Very good. चलो good. So you got 5 marks. Very good. Next one. Sakshi, you are the next one. Ready for your question?
Yes.
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 So your question is coming from OBS.
Ops.
Arvind, ready? Yeah, your question is coming from OBS. Very good. So next, pulled elbow. किसने लिखा है pulled elbow? राजवर्धन सिंह. Very good. वहाँ लिखा है कि फ्रैक्चर है फिर भी pulled elbow. चलो, come on to this case number 4. Come on to case number 4. 28-year-old primary gravid woman at 38 weeks of gestation presents to the labor room with regular uterine contractions every 5 minutes for the past 2 hours. On per vaginal examination, the cervix is 4 centimeter dilated, fully effaced, and the fetal head is at 0 station. Fetal heart rate is normal. The membranes are intact. What is the current stage and phase of labor? आराम से पढ़ो क्वेश्चन को. Take your time. You have got 3 minutes. Don't be in a hurry. It's a question for 5 marks. 28, young lady, 38 weeks of gestation, regular uterine contractions every 5 minutes for past 2 hours. PV examination, cervix is 4 centimeter dilated, fully effaced, fetal head is at 0 station, fetal heart rate is normal, membranes are intact.
Sir, अगर keyword okay, वो कर. I can reach to it then. Clue. Yes.
Clue, the first one. इस क्लू में इन्होंने लिखा है लेबर इज डिफाइंड एज रेगुलर यूट्राइन कॉन्ट्रैक्शन कॉजिंग प्रोग्रेसिव सर्वाइकल डायलेटेशन एंड इफेजमेंट. That is the only clue they are giving you.
Sir, इससे कैसे ही मैं पहुंचूंगी कहाँ पे? It's the same thing from the question.
अब ये तो देखो क्वेश्चन के साथ ही आया है. आई हैव नॉट मेड द क्वेश्चन. ये आया ऐसे ही है. चलो लेट्स सी द हिंट नंबर 2 इफ दे कैन गिव यू. ओके, इसमें तो आंसर लिख दिया इन्होंने. दे हैव ऑलरेडी रिटन द आंसर ओवर देयर कि cervical dilatation 4 centimeter and full effacement mark the beginning of active phase of first stage of labor. So they are asking you the current stage and the phase of labor. So they have written the answer already.
हाँ, वो 0 station पे था तो.
The station is 0. So Arvind, आंसर माना जाएगा कि नहीं माना जाएगा ये बताओ. देखो, you should give the benefit of doubt. Right, anyhow, I'm leaving it to Arvind. Arvind if is giving the marks or no, all up to Arvind. All right, so that is for Sakshi. Yeah, that is the first stage and active phase of labor. All right, so final answer is first stage active phase of labor. Okay, Arvind, we are moving on to the next one, case 5. Saurav, your case is from gynae. रेडी? सौरभ यू आर देयर?
Yes, sir. Yes, sir.
कहाँ खो गया? रेडी है गायनी के लिए?
Yes, sir.
ठीक है, चल. अरविंद रेडी? Yes, all right. 23-year-old newly married woman comes with painful periods since Menake. The pain starts a few hours before menstruation and lasts for 1 to 2 days. On examination, there is no abnormal finding.
Sir, ये तो कुछ question में है ही नहीं sir.
Painful period का reason they are asking you ना? What can be the reason for the painful period? On examination, कोई finding नहीं है. Hint 1, pain is cyclical associated with menstruation. The reason they want to know. Young lady, painful periods with since Menake. The pain starts a few hours before menstruation, lasts for 1 to 2 days. There is no abnormal finding.
So
क्या
can you
answer
show
होगा?
the hint one?
Hint 1 में यही लिखा है. Pain is cyclical associated with menstruation.
Primary dysmenorrhea, maybe.
Primary dysmenorrhea, sure.
Sure.
No pathology seen on examination. The most common type of dysmenorrhea is primary dysmenorrhea. Very good. So this question is right. Good, great. So Arvind, round 2 is over. Round 2 में. So what is the final scoring for all the candidates? What is the final score? So Avinash couldn't answer. Kriti 5, Lalita 5, Sakshi 5 and Saurabh 5. All 4 round 2 score. All right. All right. Perfect. Thank you so much, Arvind. Chalo. All right. So final scores are coming to me. Just hold on for a while. और ये जो बच्चे इतने सारे एंडोमेट्रियोसिस लिख रहे हो, you all are writing endometriosis. बेटा क्वेश्चन ठीक से पढ़ो तो, and that is how we make simple mistakes. Endometriosis में they are writing कि it is only
Chocolate.
1 to 2 days, right? है ना? और अगर endometriosis का केस होता तो they would have given you some other clues as well.
Chocolate cyst.
Chocolate cyst. Okay, so I'm just waiting for the final scores for all of you. चलो, good. So final scores आ जाते हैं. So let's see who has stopped. So it is for. अब इसके बाद ना ये तो हो गया आपका आज का फिनाले. Let's see who has scored on the top. किसको मिल रहा है ग्रैंड फिनाले का प्राइज? चलो, meanwhile Arvind is telling you the topper, the ranker, the grand फिनाले का winner. चलो मुझे आंसर करो. 3 questions I have kept for you, right? And it is open for all the 5 candidates here and everybody on the live chat. Whosoever answers it first, तो एक चॉकलेट मेरी तरफ से भी. इसका आंसर करो कौन कर रहा है. What is the diagnosis of this X-ray? What fracture is this? Let's see who answers first. On the screen participants या off the screen participants, कौन आंसर कर रहा है?
Smith fracture, sir.
Which fracture? Smith fracture.
Extra-articular fracture.
So ये
अब तुम चॉकलेट दोगी मुझे वापस, तो गलत आंसर है. You get trapped. देखो दोबारा देखो इसको ठीक से. कोलिस फ्रैक्चर, खुशबू का भी गलत है. गलत है.
सर डिस्टल रेडियल फ्रैक्चर.
हाँ, डिस्टल रेडियल फ्रैक्चर है. मैंने कब मना किया? डायग्नोसिस बताओ जल्दी से. क्या देखते हैं डिस्टल रेडियल फ्रैक्चर में सबसे पहले? What do you see in distal radial fractures? Whether it is intra-articular or extra-articular, right? Intra-articular ki extra-articular. Which one is that?
I think extra-articular.
Intra ki extra है. देखो.
Sir, Colles fracture.
देखो ट्रेस करो फ्रैक्चर लाइन. ट्रेस करो फ्रैक्चर लाइन. Can you see the breach? इस व्यू में देखो. Can't you see the breach? देखा? इंट्रा-आर्टिकुलर हो गया ना. कोलिस और स्मिथ हो सकता है. Can it be कोलिस और स्मिथ? कौन सा हुआ? किसी ने भी नहीं बताया यार. चॉकलेट बच गई मेरी. चलो कोई बात नहीं. फर्स्ट क्वेश्चन के लिए बच गई चॉकलेट. Shouldn't it be Barton's? इंट्रा-आर्टिकुलर है, कम्युनिटेड है, डिस्प्लेस्ड है, shouldn't it be buttons? Button में everyone gets trapped. Okay, so in your exams, don't get trapped in buttons, right? Now, second one, tell me the classification which is used to define the fracture. कौन सा fracture है, इसकी classification क्या है? What is the name of classification to be used for this injury? क्या diagnosis है? What is the diagnosis?
Sir, needs classification.
नीड्स, यहाँ पे गड़बड़ हो गया थोड़ा सा. क्या है डायग्नोसिस, बताओ जल्दी से. मॉन्टेजिया. ये कौन है? केजीआई. मॉन्टेजिया है ये. डायग्नोसिस देखो ठीक से. एवरीबडी नोज द आंसर. एवरीबडी नोज द आंसर. अभी तो ललिता ने आंसर किया इसके बारे में क्वेश्चन. कौन सा इसका फ्रैक्चर है? कौन सा ये वाला? वेरी गुड. सुप्राकॉन्डाइलर नहीं है. It is supracondylar only. What is the classification to be used?
Gartland.
Very good. किसी को नहीं मिलेगी चॉकलेट. आंसर मैंने ही बताया इसका भी. चलो नंबर 3. Tell me the treatment for this injury. इस इंजरी का ट्रीटमेंट बताओ. जल्दी बताओ, जल्दी बताओ. कौन बता रहा है इसका ट्रीटमेंट? गैलेजी. ओह वेरी गुड. मॉन्टेजिया नहीं तो गैलेजी, कुछ भी. हाँ, मॉन्टेजिया नहीं होगा तो गैलेजी होगा, नहीं होगा तो कोलीज होगा. कुछ तो लगा के आएंगे सर हम. इसका ट्रीटमेंट बताओ. एक्सरसाइज नंबर 3 ट्रीटमेंट बताओ. 1 year old गर्ल ट्रीटमेंट बताओ इसका. 1 year old गर्ल ट्रीटमेंट बताओ. ऑनलाइन बच्चों, व्यूवर्स इतने सारे, ये 5 बच्चे भी नहीं बता रहे, वो भी नहीं बता रहे. लैटरल कॉन्डाइल. ओ कम ऑन. इंट्रामेडुलरी नेल. 1 year old चाइल्ड, 1 साल की बच्ची है वो. इंट्रामेडुलरी नेल करोगे. इंट्रामेडुलरी नेल करोगे. 3 पॉइंट रिलेशनशिप. के वायर करोगे. कौन बोला के वायर? अरे 1 year old बच्ची है भाई. इट इज ओनली 1 year old पेशेंट. नो ट्रीटमेंट. वेरी गुड. पेशेंट आएगा अमंतिका के पास, ये बोलेगी कोई ट्रीटमेंट नहीं करना है, दूसरे के पास जाओ. ओरेफ, अजिन के ओरेफ करेंगे 1 year old बच्ची में. वेरी गुड. हिप स्पाइका, दैट इज अ ट्रीटमेंट. वेरी नाइस. It is hip spica. So 1 year old child, it has to be close reduction immobilization in hip spica. Very good. चलो ललिता 1 चॉकलेट. ललिता ने दिया ना आंसर? किसने दिया आंसर? ललिता ने दिया ना. चल तेरी 1 चॉकलेट पक्की. So 1 चॉकलेट फ्रॉम माय साइड. एक आंसर तो करेक्ट दिया. ऑल राइट. So okay, so we have okay. So rank 1 for the grand finale today for the DBMCI FMGE is Saurav. Saurav, congratulations. Your total score is 13 out of 15. Rank 2 is Sakshi. Congratulations to you too, Sakshi. 9 by 15. And rank 3 is Lalita. Your score is 7 out of 15. So congratulations to all 3 of you and all 2 others as well. Everyone performed well, bachon. Everyone did well. All 5 of you have cleared all the previous rounds and you all have reached here, right? Which is already a milestone, and you have been consistently preparing, consistently trying to answer all the academic queries, and that is all what is needed, right? So congratulations to all of you, and congratulations to all the people who have been watching and being a part of this quiz here. Dekho, the purpose of the quiz is not to tell that you are not prepared. The purpose of the quiz is to tell you that when you're prepared for a quiz, you're prepared for your exam as well. And that is what we believe in DBMCI FMGE all the time, right? किसी से कम नहीं हो. Each one of you have that potential to crack the exam, and that too in the very first go. It is all about how you take your exams. It is all about how you take your challenges. And if you are ready to crack them, nothing can beat you. I can tell you that, right? तो जैसे इन बच्चों ने यहाँ तक पिछले सारे राउंड पार करके यहाँ तक आए, I am telling you all the viewers as well कि this is just a very small exam. It is just a matter of time and a fact that you have to be confident about yourself, right? तो सारे बच्चों ने genuinely all 5 of you, I really appreciate the way you were trying to read the questions you were trying to answer. It is absolutely okay. So I just want from each one of you, all 5 of you and all the students who are watching us live, बेटा एग्जाम में भी ना क्वेश्चंस ऐसे ही होने वाले हैं, इसी तरह से क्वेश्चंस परेशान करने वाले हैं. और what you need to do is to crack the language of the question, and that will only happen with practice. So practice more and more and more and more and more, and that is all what you need, right? All these questions have been taken up from Marrow Q Bank only. Last 3 images I just posted to just revise few very important, images from your orthopedics point of view. But yeah, but what I want from you all, stay consistent. आज जो गलतियां जितने लोगों ने की, यहाँ 5 बच्चों ने की, ऑल ऑनलाइन यूजर्स ने की, जितने भी हैं सब बच्चे यूट्यूब पे अवेलेबल हैं अभी, जितनों ने जितनी जल्दी की क्वेश्चन पढ़ने में जो जो गलतियां की ना, प्लीज मेक इट अ लेसन, राइट? Lalita and Sakshi and everyone, Avinash, your answers were coming, but they were coming bit little late, right? So what I would advise anybody who takes some time to read the questions, एग्जाम से पहले बहुत प्रैक्टिस करो, प्रैक्टिस एंड प्रैक्टिस एंड प्रैक्टिस एंड प्रैक्टिस। और प्रैक्टिस सिर्फ ये नहीं करनी कि मेरा आंसर कितना सही है, you have to prepare your mind in a manner that you can crack the answer very quickly as well, right? और उसके लिए आंखें ना उतना ही देख पाती हैं जितना हमारे दिमाग को पता होता है। Eyes can only see what the mind knows, and mind knows too much, but if the eyes still are not able to see, इसका मतलब हम क्वेश्चन ठीक से पढ़ ही नहीं रहे, right? So every question has been able to give you a clue. Every question was trying to suggest some clue. It is all up to you how you are taking it, right? So that is my suggestion to all of you. Yeah, that is my suggestion to all of you. अपने एग्जाम के लिए भी, okay, so अपने एग्जाम के लिए भी prepare in the same manner. Keep on reading the questions very very carefully. हर क्वेश्चन के लिए गिव टाइम, बट प्लीज मेक श्योर इतनी प्रैक्टिस कर लो अभी कि एग्जाम वाला दिन भी ना नॉर्मल प्रैक्टिस वाला दिन लगे, कि जैसे रोज प्रैक्टिस करते थे वैसे एग्जाम में भी क्वेश्चंस हो जाएंगे, राइट? सो अरविंद, एनीथिंग यू वुड लाइक टू से और एनी वन ऑफ यू? सो सौरभ, कॉन्ग्रेचुलेशंस, एक पार्टी अब तुम्हारी भी बनती है, राइट? सो साक्षी, कृति, अविनाश, कॉन्ग्रेचुलेशंस टू ऑल ऑफ यू. You all have done a commendable job, and those who are watching us live, please take inspiration from each one of you, each one around you, I can say, right? Each one of us has to support ourselves. It is a qualifying exam, and this qualifying exam should be a byproduct for your preparation for the NEET or INI set, right? Target should be NEET, target should be INI, and this is just a byproduct, and you all are going to do that, right? So अपने questions को अच्छे से पढ़ो, अपने questions में से keywords ढूंढो. Keywords will take you to the answer. Don't forget to read very carefully, other than this, except then this, and all that kind of exclusion criterias, उनको अच्छे से पढ़ना, right? And anyone who wants to connect with us anytime for any kind of discussion about your preparation strategy, right, for your upcoming exam on 17th of January, we are always there. Your mentor duo is always there at DBMCI FMGE Delhi here right now, and feel free to connect with us anytime, right? Thank you so much, Sakshi, Lalita, Saurav, Kriti, and Avinash. Thank you so much, everyone, for being a part of this wonderful session, right? And thank you, Arvind, Dr. Vibhuti, everyone. Ankit, thank you so much for conducting the session. Arvind, would you like to say something? Okay, so the winner, let me tell you all, Saurav is going to get an iPad, right? So stay tuned. And ये iPad जो है वो काम में आने वाला है, I think. अब तो notes उसी में बनने वाले हैं, नहीं सौरभ? Don't leave your
yes
notes.
sir, लिखने में बहुत difficulty होती है.
है ना? I know. So winner is going to get an iPad. That is a message I have. So congratulations once again, right? So Arvind, anything else you want me to convey? But wonderful audience, wonderful participants, and a wonderful show. Thank you so much, team, for organizing this. Stay tuned, those who have missed it this time, and we can definitely plan some more quizzes in the upcoming time for all of you, right? So stay tuned, keep studying, stay hopeful, stay positive, stay confident, and know that you all can do that, and you all are going to do that, right? So keep telling your mind every single day, today is going to be an awesome day. And by the time you are going to sleep, make sure to count what all productive you have done in the day. There should be not even a single day passing without a productive work. Just keep on doing 1% improvement in what you have done yesterday. Just 1% improvement in your work, what you have done yesterday, will make you 30% improvised version of yourself in next 30 days, right? By the time your exam comes in the next 3 or 4 months, you will be 100% improvised version of yourself, right? So keep studying, stay confident. 1% बहुत कम होता है, इतना तो कर सकते हो, right? Just 1% is going to make a big change. So stay confident, bachcho. All the very best to all of you. Thank you so much for being the wonderful audience, wonderful participants. All the very best to all of you for exam, and looking forward to hear from all of you about your success stories. So all the very best. Thank you so much.
Thank you, sir.
Thank you, sir.
Thank you,
Thank
sir.
you, sir.
Thank you,
Thank you
sir.
so much.